The following segment is sponsored by Providence Health and Services.
Clinical trials help create new treatment options and give hope to those fighting cancer. But for the patients who volunteer their time and bodies for these studies, success is not guaranteed. These trials really are an experiment. One Portland man took that leap of faith, and it paid off. KATU's Wright Gazaway reports.
There's a moment in time that changes your life if you sit in front of a physician, a doctor, and they say you have cancer.
This is Dean Lookingbill, and that life-changing moment he's talking about happened to him in 2018. He was diagnosed with large B-cell lymphoma, an aggressive and fast-growing form of cancer.
Part of what I think is important for people to hear about cancer treatment is it's got science, you've got the medical caregiving, and for me, you have faith.
Dean went to the Providence Cancer Institute to receive medical care. He was declared cancer-free after completing chemotherapy, but the lymphoma returned just 2 years later. This time, the chemo didn't work.
You sit in the room with the oncologist, comes in and says, it didn't work, the chemotherapy, but don't lose hope. We're going to put you in for CAR-T.
Dr. Natasha Edwin is Dean's oncologist from Providence.
CAR T cells, which is what our patient received, is nothing but the patient's own white cells that are taken out of his body, genetically engineered and supercharged to fight the cancer, and then reinfused back into the patient so that they can do their magic and eradicate all of that cancer.
Dean had this procedure done during a series of clinical trials. It's called CAR T cell therapy. He didn't know if it would work, but it was his only option.
Once patients have had cancer that is refractory to chemotherapy, cancer that really hasn't responded to chemotherapy, the outlook is usually dismal.
Luckily, the therapy was successful. Dean's cancer went into remission in August 2021.
Or had we not had CAR T cell therapy, his survival would have been measured in months.
Dean never lost hope, even when he was up against those scary odds.
It can be hard. Sometimes you waver in that hope. And to have people around you that help you hold on to that hope is very important, at least in my journey with cancer.
And while it was the CAR T cell therapy that saved Dean's life, he says he wouldn't be alive today if he had not held on to hope.
Wright Gazaway reporting. And this month marks 3 years since Dean completed that CAR T-cell therapy. His health is good, and the cancer shows no sign of returning. The Providence Cancer Institute is committed to finding innovative treatments for all kinds of cancer. We have more information about the research they're doing on KATU.com/Family Matters.